What does it look like to reimagine the possible and change the way that we think about healthcare technology? It looks like the future. A future where we can conduct clinical trials and develop new therapies from anywhere, so we can deliver the right care everywhere. And where physicians and patients are empowered to make more confident decisions with technology that leads to smarter outcomes. It's a future that facilitates innovation and collaboration on an unprecedented scale and orchestrates people, insights, and technology to redefine what's possible as we turn our new ordinary into the extraordinary. The future of healthcare is now. Let's explore it together.
What does the future hold for healthcare? In 5 years? 10? How will patients experience care, and how will clinicians deliver it? And what role will security and IT operations play in keeping critical functions online and secure? Today, the Internet of Things, IoT, is improving access to quality care and reducing costs by tracking equipment, patients, and staff, plus much more. We've just begun to scratch the surface. The possibilities are endless. Extending healthcare to the home is already making it possible to collect data and track wellness, which is changing the management of chronic pain and disease. Soon, this data will be integrated seamlessly into electronic health records, so doctors can remotely monitor patients in real time, and it will be more and more common to meet with your doctor from home through telemedicine. Augmented reality, which uses digital images superimposed on live content, and virtual reality, an artificial 3D environment, are some of the hottest technologies today. In healthcare, they can be used to treat addiction, phobias, and PTSD, as well as to help doctors learn about anatomy and test surgical techniques. Artificial intelligence, or AI, is the ability for computerized machines to mimic human thought processes. AI, combined with natural language processing, could provide clinical decision support, such as automated symptom triage. In the future, AI could break through boundaries in ways we can't even conceive of right now. Robotics, already used in medicine for transportation, pharmacy automation, surgery assistance, and more, is becoming an essential part of our future. With Wi-Fi 6 and real-time haptic feedback, doctors could perform surgery enhanced by AI. Everything you do today and tomorrow, from deploying telemedicine services to implementing AI for clinical decision support, depends on a strong IT infrastructure. All your systems, network, mobility, collaboration, security, and data center need to work together seamlessly to support the changing face of medicine. And Cisco can help.
The positive and negative impact of information technology in health/health services. There are no two ways about it. Technological developments in healthcare have saved countless patients and are continuously improving our quality of life. Not only has that, but technology in the medical field had a massive impact on nearly all processes and practices of healthcare professionals. Positive impacts. Digitalization of health records. Electronic health records, EHRs, replacing outdated paper records has been a massive game changer for everyone in the medical world. Medical assistants to medical coding professionals to registered nurses are just a handful of roles that have been impacted by this industry-wide implementation. Nurses and technicians are responsible for inputting patient data into a central, digitized system. Medical billers and coders appointments update patient records with diagnostic codes, such as test results, and submit medical claims to insurance companies. Not only can patients access their records at the click of a button, but it's also ensured that mistakes are caught more quickly, without needing to pore over unreadable physicians' handwriting. Among the many benefits that electronic health records have brought to healthcare include improved public health. EHRs provide invaluable data to clinical researchers, helping to advance medical knowledge and the development of treatments for common health problems, like viral outbreaks. A standardized health IT system can provide insights into how widespread an outbreak is, enabling preventative measures, such as increased flu shot production, to be put in place much more quickly. Ease of workflow. Medical billers and coders are some of the most impacted allied health workers, and, according to the Bureau of Labor Statistics, demand for this sector is expected to increase by 13% from 2016 to 2026. The introduction of EHRs has only made life easier for medical billers and coders. Entering data into a computerized system is much less time-consuming than paper-based methods, and it reduces the risk of errors in patient data and financial details. Accessing patient records digitally also allows medical coding experts to work from home, increasing efficiency and productivity. Lower healthcare costs. According to a study from the University of Michigan, shifting from paper to electronic health records reduced the cost of outpatient care by 3%. These researchers estimated this as $5.14 in savings per patient each month. In a large city hospital network, that amount is incalculable. Better and safer data storage. Cloud computer technology allows for masses of information to be stored at an unbelievably low cost, all without the limitations and expense of additional hardware or servers. With an increased reliance on EHR systems, cloud storage protects against the loss of sensitive data with strong backup and recovery services. Information and Communication Technology, ICT, link healthcare professionals, as well as professionals with patients. Email, smartphones, telemedicine, and telemonitoring systems are all used to share information and are especially useful for more rural areas and locations with a lack of facilities and/or specialists. The terms telemedicine and telehealth can be used to refer to two-way video consultations, or the transmission of healthcare data like electrocardiograms. Telemedicine can be used in many fields, especially in a sector like cardiovascular healthcare. Telemonitoring technology can monitor vital signs, symptoms, and even blood levels from a remote location. Future cardiac monitor technicians will be happy to learn that AliveCor is developing a device to detect potassium blood levels to prevent hyperkalemia. Though not yet approved by the FDA, this is a perfect example of how technology is meeting the needs of at-risk patients, especially useful for more rural areas and locations with a lack of facilities and/or specialists. Technology provides benefits to patients, but it also brings significant risks that can threaten patient safety. Negative impacts. Life-saving radiation therapy can have devastating consequences if errors occur. Likewise, inappropriate use and dose levels of CT can lead to unnecessary radiation exposure for patients. Adverse events are probably underreported. There isn't a good reporting system in place to define what is a reportable event, says Keller. Hospitals need to maintain adequate staffing levels and quality assurance procedures. For radiation therapy, facilities need to ensure that staff follow and document standard patient treatment procedures, including double checks and timeouts, and develop standard checklists. Poor posture. The way many people use mobile devices and computers may also contribute to incorrect posture. Over time, this may lead to musculoskeletal issues. Many technologies promote a down and forward user position, meaning the person is hunched forward and looking down at the screen. This can put an unnecessary amount of pressure on the neck and spine. Reduced physical activity. Most everyday digital technologies are sedentary. More extended use of these technologies promotes a more sedentary lifestyle, which is known to have negative health effects, such as contributing to obesity, cardiovascular disease, type 2 diabetes, premature death. The risk of medical records hacking. In 2015, hackers stole records for almost 80 million Anthem customers and employees, the second largest health insurance company in the U.S. Only names and addresses were stolen, no details of illnesses or treatments were exposed, but if this can occur to an insurance giant such as Anthem, it raises questions about how safe patient records really are in your local clinic. Patient records are apparently big business, with stolen health credentials fetching upwards of $10 each. about 10 or 20 times the value of a credit card number. The information on these records can then be used to create fake IDs, to purchase medical equipment, drugs, or submit false insurance claims. The disadvantages of mobility. Even with the most advanced technology, human error can't be erased completely. Mobile devices can be easily lost or stolen, and they're also vulnerable to hacking, malware, and viruses, especially if the devices are used on unsecured internet connections. I chose the positive and negative impact of information technology in healthcare services because, as we all know, during this pandemic, our health is really important. Knowing the positive and negative impact of IT on it, we can be more aware and be cautious in our health. Even before COVID, artificial intelligence helped organizations engage with customers and automate and enhance business processes. We have more data than ever before, and AI allows us to make sense of the data faster, and IT really has a great role in making those data process faster. During the COVID pandemic, when time was of the essence, AI helped public health officials predict infection rates as well as ACU demand and capacity. Technologies like chatbot and virtualized patient care offer a mechanism to triage and distribute care at scale. Artificial intelligence and high-performance computing have accelerated research into understanding the virus and developing targeted therapeutics to treat infection and prevent transmission. New mobile contact tracing protocols that preserve patient privacy and civil liberties were developed in response to public concerns, creating new opportunities for privacy-sensitive technologies that aid efforts to prevent and control outbreaks. While much progress is still needed, the COVID-19 pandemic has highlighted technology's importance to public health security and pandemic preparedness.